It's time for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with a look at containing outbreaks and preventing epidemics. Hello, Linord.
Hello, Esther. It's good to be here next to you.
Right.
Well, it's in its second Epidemics That Didn't Happen report, the organization Resolved to Save Lives showcases inspiring stories of how careful planning and swift strategic action have stopped outbreaks of infectious diseases such as Ebola, dengue, rabies, and even the flu in the past year. For more insight, I spoke with Amanda McClelland. She is Senior Vice President of Prevent Epidemics at Resolve to Save Lives, and Dr. Precious Matsoso. She is a World Health Organization advisor, former Director General of South Africa's Department of Health, and co-chair of the Intergovernmental Negotiating Body for Pandemic Treaty with WHO. Take a look.
Amanda McClelland and Precious Matsoso, thank you so much for joining us. When we saw how much COVID had impacted the world, regardless of economic status, what does it tell us in terms of where the priority should be to prevent epidemics?
I think every country has a responsibility, whether it's low income or high income. I think there's a lot to learn from low income and middle income countries in how they addressed COVID with a holistic approach. But we've definitely seen an erosion of their capacity and resilience in their communities. And we're seeing some of those outbreaks that used to be fairly easy to control, like measles and cholera, really surging back now. And I think that really shows that this is a constant investment. We need to sustain and expand this investment. Diseases that we thought we had conquered, like polio, will take every opportunity to come back. And so the Epidemics That Didn't Happen report really demonstrates that this is a fight that we have to make every day, an investment that we have to make every day to make sure that we control outbreaks and reduce the impact for all countries.
Precious, when we talk about building strong preparedness systems and decisive response plans, what does it look like, especially if we compare, between high-income countries and low and middle-income countries?
Your health workforce must be trained, and you must ensure that they are competent. Your lab systems and the speed at which you get results must be good, because it's not enough if you have laboratory services, but your results are delayed. The CDC always talks about, I call them disease detectives. Train your disease detectives so that they can be able to detect early and be able to respond with speed. There's a proposal to say this idea of having a 717. Within those 7 days, detect and establish what has happened. Within a day, report. Within 7 days, you must be able to respond.
Amanda, what surprised you in this report this time around, and what sort of impact do you anticipate or do you hope this report can make in future outbreaks?
What surprised me was the progress that Guinea had made. I was there in 2014. The community was heavily devastated and overwhelmed, and they made smart strategic investments. And I was really proud to see that they identified Ebola quickly and they controlled it quickly, and they shared those lessons. Similar to DRC, who faces this Ebola challenge. And then I think the Indonesian example about communities finding solutions for themselves. The Indonesian community faced the challenge of dengue, but they found community-based solutions that help them identify when someone in the community has dengue, and they take local action. They don't wait for the Ministry of Health to come. They mobilize quickly and they try to address where the mosquitoes are breeding. They get their community members to the clinic quickly. And a government that really identified that epidemics are a social and political and economic event, not just a health event, and invested smartly to make sure that they didn't suffer the same fate that they did during 2014.
It's something when we talk about preparedness, right? But it seems like when there is an outbreak, countries are catching up instead of being one step ahead if they are so well prepared.
I think preparedness is a choice of investment, and we haven't made that choice regularly enough. Too often we wait for the response to come and we surge in. And there's been some metaphors related to fire. We too often are waiting for the outbreak to occur and rushing to put the fire out, and you're always behind. We need to invest in those fire alarm systems, those rapid response teams, the building codes that limit the chance that fire breaks out. And that's why we think Epidemics That Didn't Happen is important, because when we're successful, when we are in front of it, no one hears.
When we do those joint external evaluations, it's like a one-time snapshot. You look good at a particular point in time, and that talks to what you're asking about the US and other well-resourced countries. 3 months later, you may look different. So the idea of those joint external evaluations that trigger the development of a preparedness plans should be tested on an ongoing basis.
We're really proud of the report and to be able to shine the great work of public health and communities in finding outbreaks quickly and responding and controlling them, and highlighting the need to continue that investment consistently so that we're able to do that for every outbreak, and that the Epidemics That Didn't Happen report becomes all outbreaks and not just a handful.
I think perhaps these are lessons learned that can be shared. Those countries that did their best with meager resources, but they were able to tackle these outbreaks. Let's share these with others so that they can make those wise investments.